Hello everyone, this is Dr. Sam and today we will study chest X-ray lung pathologies. Studying chest X-rays can be complicated. That is why it is important to have a systematic approach. We will only see lung diseases in PA view in this video. Here we have normal PA views showing clear lung fields. In radiography, we can divide the lung into three zones. 3 zones in the left lung and 3 zones in the right lung. Keep in mind that these lung zones do not correspond to lung lobes. These are just used in radiography to aid in diagnosis. The upper zone starts from the apex to the superior margin of the hilum. The middle zone is from the superior margin of hilum to the inferior margin of hilum. Lastly, the lower zone is from the inferior margin of hilum to costophrenic sulcus. The first disease is tuberculosis. In pulmonary tuberculosis, it can present as upper zone opacity. You will see a bright area here in the right upper zone, that is the apical region. Opacities in the upper zone are most commonly due to tuberculosis. A pulmonary cavity in the apical region is a classic sign of tuberculosis. Cavity will appear usually as a round structure with radio-opaque border. That is a bright border with a radiolucent center, that is a dark center. Here is another image showing small nodules in the left upper zone. This appearance can also occur in tuberculosis. Consolidation refers to filling of air spaces with fluid, blood, pus or some tissue or mass, and it will appear bright. Bilateral consolidation is another feature in tuberculosis. It is involving the upper and middle zones. Here we can see cavities in both upper zones of lungs in tuberculosis. In biliary tuberculosis, numerous small nodules will be uniformly distributed throughout both lungs. They measure between 1 to 3 millimeters in diameter. Klebsiella pneumonia infection also affects the upper zone mostly, and if we talk about lung lobes, it affects the upper lobe. It causes right upper lobe consolidation. Sometimes we can see lung fissures on PA view. It is difficult to see fissures because they are very subtle and have variable location in different individuals. Here we can see the horizontal fissure, a small white line, but in case of a pathology, a fissure is seen more easily. Bulging fissure sign helps in diagnosing Klebsiella pneumonia. There is inferior displacement of horizontal fissure due to expansion of the affected part of the lung. Here we can see right upper lobe consolidation. The consolidation is the bright area and usually occurs due to pneumonia. This consolidation has made the horizontal fissure prominent. We can see it very easily. The consolidation is above the horizontal fissure, so it means it is in the upper lobe of the right lung. Right middle lobe consolidation is seen in this image. The consolidation is below the horizontal fissure, which means the middle lobe is involved. Usually it is due to pneumonia, but it needs clinical and lab correlation to diagnose it. Now we move on to left lower lobe. In this image, there is left lower lobe consolidation. It usually occurs in pneumonia. Air bronchogram is a feature in which the air-filled bronchi become visible due to surrounding consolidation. Here we can see the dark bronchi which became prominent because of the nearby consolidation. In the normal image, we cannot see the bronchi in this area because there is no neighboring consolidation. An air bronchogram seen through the heart is a sign of lower lobe consolidation, and this can differentiate it from a left lower lobe collapse. In this image we have right lower zone opacification. It occurs mostly in the setting of pneumonia. Bacterial pneumonia usually has lobar consolidation. Pneumocystis pneumonia is an atypical pneumonia. Usually it presents with nematoceles, which are thin-walled, air-filled cystic structures seen within lung parenchyma. Linear opacities can also be found. They are called reticular opacities. These bright lines are reticular opacities. Here we got an image of pneumocystis pneumonia with a large pneumatocele in the right middle and lower zones. Viral pneumonia usually involves both lungs. It has a diffuse interstitial pattern consisting of reticulonodular opacities. Here is another image of viral pneumonia. COVID-19 pneumonia usually has this type of appearance in a chest X-ray. Lung atelectasis refers to collapse of lung parenchyma. It can occur due to cancer, mass, or a foreign body, and even some diseases. Here we have right upper lobe collapse. In this case, the horizontal fissure will be displaced superiorly. As you can see, here the fissure has moved upwards due to upper lobe collapse. Normal right medial cardiomediastinal counter is lost as well due to lung collapse. The right main bronchus bifurcates into two bronchi. One of them is bronchus intermedius, which can be seen here. Normally it has a vertical pathway, but in upper lobe collapse it has rotated laterally and has become horizontal. Elevation of hemidiaphragm can also occur in right upper lobe atelectasis. You can see that the right hemidiaphragm is much higher than its normal location. In this image, we have left upper lobe atelectasis. The left upper lobe is collapsed. In this collapse, the opacity, this bright region, will extend from the left hilum. The inferior part of the opacity is faded. There is no well-defined border seen here, and the cardiomediastinal counter is lost. The left hilum may also be displaced upwards due to the collapsed lobe. The left main bronchus is displaced upwards as well. You can see the difference in appearance of the left main bronchus. It has become more horizontal than usual. The superior segment of left lower lobe is hyperinflated and can be found between the collapsed lobe and the aortic knob. It will appear as a dark radiolucent area. This sign is called the Luftsichel sign. Here is a different patient with left upper lobe atelectasis showing the Luftsichel sign. Juxtaphrenic peak sign is another feature in left upper lobe atelectasis. The hemidiaphragm will have a peaked appearance. It has a sharp point. Lobar collapse may be accompanied by pneumothorax, which refers to presence of air in the pleural cavity. There is increased radiolucency in the area around the collapsed lobe. Right middle lobe atelectasis is seen better in a lateral view. In a PA view, It just appears as an opacification in the middle or lower zone. It is a non-specific feature. This is an image of left lower lobe atelectasis. The left lower lobe is collapsed. Retrocardiac sail sign is a distinct feature of left lower lobe atelectasis. The left lower lobe is displaced medially, which forms a triangle-shaped bright structure with sharp margins behind the heart. You can see the bright triangle behind the heart. Double cardiac contour is another feature of left lower lobe atelectasis. It is formed by the collapsed lung. We can see two cardiac contours, one here and another one here. It looks as if the heart has two outlines. Flat waist sign is another feature of left lower lobe collapse. The left heart border will be flattened. The aortic knob and pulmonary trunk contours are also flattened. In the normal image, you can see the aortic knob very well, whereas over here it is flat. The left hemidiaphragm may also be elevated. Here it is much higher than its normal location. The mediastinum may also be shifted to the left because of the collapse. The heart shadow is missing in this area because it has shifted to the left side. Here we have right lower lobe atelectasis. A triangle-shaped opacity is seen in the right lower zone. The right hemidiaphragm is also obscured. The horizontal fissure is displaced inferiorly. The fissure has moved downwards due to lower lobe collapse. Right lower lobe atelectasis has its own feature. It is the superior triangle sign, in which there is a triangular shaped opacity in the right upper zone. You can see this bright triangular structure here. It is formed by the right-sided mediastinal shift. You can see much of the heart has shifted to the right side. Here you can see visual differences between a consolidation and atelectasis on a chest X-ray. The consolidation and atelectasis are both found in the left lower lobe in these images. A feature like air bronchogram through the heart favors a consolidation, and features like retrocardiac sail sign and double cardiac contour favors atelectasis. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.